antibiotics, toxins, poor diet, parasites, medications, infections. It's an immune problem. It's an immune reaction. We want to test your neurotransmitters. That's one of the forms we have in the packet that we send you. And if you're watching this on the website, request the information under the contact information. We may check hormone panels, but I will tell you folks, if you're autoimmune, it trumps everything else. It trumps all other problems. Inflammation, we want to test C-reactive protein and homocysteine. I guarantee you, if you have fibromyalgia, you have inflammation. Glutathione. Glutathione is the mother lode of antioxidants. It's one of the best things that we can do to help your condition nutritionally. And we use glutathione in our office. So we've handled the metabolic side, the right hand. Let's handle the left side, the neurological side. Okay? Remember how I said Broca's speech area? Usually fibromyalgia patients have decreased firing in their left brain. And what happens is we'll do some tests. And, you know, if your left brain isn't firing, guess what? You're going to be depressed. You might have anxiety. You're going to have trouble, difficulty speaking. Things are on the tip of your tongue, can't get them out. You may have this brain fog. Because Broca's speech area, what allows me to speak to you, what allows you to speak to others, is in the left frontal lobe. And it connects to an area of the brain called Wernicke's area. And Wernicke's area allows you to understand what's being said to you. And this is where fibromyalgia patients, they get into this brain fog. So one of the things that we use with fibromyalgia patients that works very successfully is oxygen therapy. Your brain and nervous system need two things to survive, folks: fuel and activation. Fuel is oxygen and glucose. And we've covered the glucose on the metabolic side. But as you age, your ability to utilize oxygen decreases by 1% per year. I'm 50 years old. And from the time I'm 25, it's decreased 1% per year. So I've lost 25% of my oxygen carrying capacity. So this is why we use exercise with oxygen therapy with all of our fibro patients. And it is extremely successful. Now the thing is, and oxygen is ordered by our MD, you have to set it at a very low level. Fibromyalgia patients are very easily overstimulated. We call it exceeding metabolic capacity. That's why you may have gone to another chiropractor. They adjust your neck structurally, popping and cracking, for lack of a better term, and you got worse. It was too much stimulation. You see, this is why a lot of fibromyalgia patients are sensitive to chemicals and things. Their nervous system has been bombarded. And so you just got to go slow and easy. That's why you got to do the metabolic side along with the neurological side. And that's how you get fibromyalgia patients better. That's how we get people better. Nobody else is getting better. Nobody. But yet, you go to the national associations of fibromyalgia, and guess what? They don't want to hear any of this. They don't want to hear any of this because they are getting support, and for lack of a better term, money from major drug companies. And if somebody's paying you a lot of money, guess who you're going to support? It's sad, but it's true. And if they don't like it, too bad. I'm allowed to have my opinion. We're going to do brain-based therapy. We may do vibration therapy, not right away to start because sometimes it exceeds metabolic capacity, but vibration stimulates the back part of the spinal cord, calls the dorsal columns, goes up to the cerebellum, fires up to brain. See, neurologically, the reason you have fibromyalgia is the cerebellum fires to brain, brain fires to the lower brainstem. There's three parts to your brainstem: top, middle, and lower. And that lower two parts, the pons and the medulla, get the firing from the frontal lobe. Cerebellum fires to frontal lobe, fires to lower brainstem. And you've lost that loop. It's not happening. So that upper brainstem overfires. It drives down your spinal cord, called the, well, we don't have to get into the specific neurological parts of it. But it drives down your spine, and that's what's causing all these pain syndromes. Well, it's the intermediate lateral cell nucleus. See, it means nothing to you. It means nothing to you at all. I could throw out neurological terms to you all day. It doesn't matter. What matters is you want to get better. We may use laser therapy. Laser helps heal the tissues. If you have back or neck pain, we may do non-surgical spinal decompression, but at a very, very low setting. We may use something called the interactive metronome. It's visual, auditory, and motor stimulation. It helps fire the frontal lobe down to the lower brainstem. And you can look online at interactivemetronome.com. So ask yourself, folks, the following questions, please. How has your fibromyalgia affected your job, relationships, family, finances, or other activities? I can guarantee you it's affecting your life. What does it cost you in time, money, happiness, and sleep? Where do you picture yourself in the next 1 to 3 years if your fibromyalgia isn't taken care of? Finally, what is it worth to you if we could eliminate your fibromyalgia? I don't want to say cure. What is it worth to you? See, some people aren't serious about their health. I've had some fibromyalgia patients come in, well, it's not that big a deal, or they'll come in and they're sensitive to gluten and they keep eating gluten. You know, if the lady that I mentioned to you at 400 units would keep eating gluten, I would not continue to see her as a patient. So what is it worth to you? Here's what we're offering. If this all makes sense to you, and hopefully it does because you've been everywhere and done everything, we're offering you 2 free visits. You come in after you've watched this video, paperwork filled out, I'll review the case history, we'll do a screening, we may or may not take an x-ray, and then what we'll do is have you set up another appointment on the second visit. In between the first and second visit, I will review all of your material. And on the second visit, I'll let you know if I accept you as a patient or not. I don't accept everybody. I only accept people who are serious about their health. I only accept fibromyalgia patients that truly want to get better. So, if you want to get better, if you're serious about this, you'd like to come in for the 2 free visit offer, call our office, 920-739-6971, 920-739-6971. This is Dr. Johnson saying have a great day, and I look forward to seeing you in the future. Thanks.